Hello. It's a very light session, so please relax. Okay, is everybody in? Maybe before the doors are closed, we can also allow those who are seated outside to come in. I think they were waiting for us to settle down. Okay, a couple of seconds for everybody to come in. All right. I'm happy to see you all here. Thank you so much to everyone who made the time. And for those who came early, a very special, big thank you to you all. So, Your Excellencies, distinguished guests, delegates, youth leaders, colleagues, friends, youth representatives, a very warm, or should I say, a very hot good afternoon and welcome. And for those who are here in New York, those who are joining us online, a very warm welcome to you all. So, like I mentioned, I'm very happy to see you all here. And I note that this is a very diverse group of people, which makes me glad because the conversation we're having today is a global one. It's global in nature. And I would like to introduce myself. My name is Nsansha Faith Chilupula. I am a co-chair of the UNEG Working Group on Young and Emerging Evaluators. I also work as an evaluation analyst at the UNFPA Independent Evaluation Office. So I recognize that we have different people representing different organizations, different countries. And I must say, in my home language or in the country of my origin, we say Mwaiseni. And in Kenya, where I'm coming from, we say Karibu. So I welcome you all to our side event, which is where we will discuss moving from evidence to action, unpacking what works for youth in health and mental health. So today's discussion, we'll discuss the preliminary findings of the ongoing interagency exercise, what we call a meta-synthesis on the youth strategy. And this meta-synthesis exercise focuses on health at the moment. Previously, it focused on employment and education. And one of the key things that we'll have is, first of all, a presentation on these findings and unpacking it through a panel discussion as well as Q&A session with everyone in the audience today, as well as those who are joining us virtually. So before we get started, I would like to mention a few housekeeping points. The first one being, for those who are here in the room, I am kindly asking that whilst I'm doing the intro, if you could put your phones on silent so that we don't distract those who will be speaking in front. And for those who are joining us online, we kindly request that you utilize the chat that is at the bottom of your screen, or the Q&A feature if you want to ask some questions. For the chat, we ask that you place where you're joining us from. And also, if you have a shout out for someone in the audience here, please utilize the chat for that as well. Finally, for those who are also joining us online, you have what is called the closed caption feature at the bottom of your screen, where if you want to change the language and put it according to a language you prefer or a language you understand, kindly utilize it, and then you can follow the conversation effectively. All right, with that said, I think we can get started. So to set the stage for our discussion today, allow me, and it is my great privilege and honor to welcome to the stage the youngest minister in the history of Paraguay, Her Excellency, who is serving as the Minister of Youth, Ms. Sauma Aguero. Please, I welcome you to the stage. A big round of applause, ladies. You can do better. A big round of applause.
Distinguished authorities, colleagues, dear young people present, this morning the different speakers talked to us about how important it is to move from words to actions. So this is why in this opening, I would like to talk to you about the examples that what we are doing now in our country. So it is an honor to me to address you in this space in which evidence brings us together, but where above all, action challenges us. Today we know that evidence is clear that mental health is one of the greatest challenges of the development in our young population. But we also know something more important, that is not enough just to recognize the problem. We have the responsibility to act with decision, with sensitivity, and with public policies that transforms realities. To speak mental health is to speak dignity, is to speak of opportunities, is to speak of the real possibility that every young person can build their life project without carrying in silence that would hurt them inside. So in Paraguay, from the National Youth Secretariat, we have assumed this challenge with a clear focus to raise the flag of hope and by addressing this reality comprehensively. A concrete example is the work developed at the Comprehensive Adolescent Care Center, Maria Goretti, located in a vulnerable neighborhood of the country. Between October and December of 2025, we implement a pilot model of comprehensive care that combine psychological services, mental health group workshops, and mentorships. In just 3 months, we managed to carry out more than 360 psychological consultations in 12 workshops, reaching young people who needed more than answers, safe spaces to be heard. In this process, I tell you that we encountered difficulties and we saw that we did not have the sufficient quantity of professional psychologists to attend all the demand. And it was there in that challenge that we saw an opportunity. And we made the decision to make students of the final years of psychology part of it as interns remunerated by our secretariat, who not only acquire work experience for their careers and receive an additional economic help, but contribute actively to community well-being under supervision and collaboration of professionals. This demonstrated that investing in youth is also trusting in their capacity to be part of the solution. Likewise, we promote the International Congress of Mental Health and Soft Skills, an initiative that exceeded our expectations. More than 6,000 participants in the biggest mental health event that my country had. These numbers reflect a forcible reality. The youth want to talk about mental health. They want tools. In the same line, we developed the training cycle in emotional intelligence at national level in the framework of the Dating Without Violence campaign at the action plan against drugs consumption, reaching more than 10,000 young people in the department of the country. But beyond the numbers, the impact has been deeply human. We are sensitizing society, achieving that this topic stops being a taboo of which one never talks, and reaching the points most distant from the capital, where today we can affirm with conviction that we are not only training young people, but we are saving lives. We know that timely help can be different between life and despair. That is why we partnered with our Ministry of Public Health to promote Why Fine Fine Fono Ayuda. It's a free, confidential, 24/7 service that assists more than 10,000 people since May of 2025. Ultimately, evidence counts when it leads to action and shared commitment. Paraguay will continue to take firm steps, but we must understand that it is a global challenge, not just a national one. That is why we are here today. So today we have the opportunity, we have the responsibility, the obligation to turn these insights into action. Every diagnosis into public policy, and every young person into the center of our decisions. So may this space be a starting point to build together. Thank you.
Another big round of applause, ladies and gentlemen. All right. Thank you very much, Ms. Aguero, for the insightful opening remarks and also for reiterating the commitment that you are making to young people as well as health in your country and in the globe at large, because whatever you're doing, I'm sure others may learn and also replicate and put to scale. So to ground our conversation today in evidence, allow me to welcome to the stage the evaluation specialist from UNICEF who is co-leading this exercise. Remember, I said this conversation is part of the broader exercise of the meta-synthesis on youth and focusing on health this time around. So Ms. Tammy Aritomi will present to us the preliminary findings of this meta-synthesis exercise. Ms. Tammy, please, the stage is yours.
Thank you, Faith, for the introduction and acknowledging that we are co-leading with UNFPA, and my colleague, Karen Cadondo, was not able to come today, but she's been very active monitoring all the events, so thank you. Our presentation today will focus basically on providing some highlights. As Faith mentioned, we are working on this meta-synthesis, and we would like to present some initial highlights of the reports that we are analyzing, evaluation reports to advance the UN Youth Strategy. This is the fourth exercise, and we focus on the youth strategy priorities, specifically of youth and health, as you know. Similar to previous exercises, this synthesis will look at UN system work over the past 10 years to answer a simple but yet very important question. What works, for whom, and in which context, and where are the gaps that still remain? Rather than looking at individual projects, we are focusing more on identifying patterns across the different countries, across different contexts, and we would like to understand what consistently leads to better outcomes, and where we are tending to fall short, sorry. In this exercise, we have assessed over 590 evaluations from 16 UN agencies that focus on youth and health and mental health. And we have leveraged the power of AI to do a very comprehensive synthesis analysis that was guided also by thematic experts in the field. Thank you. Just to give you a bit of a highlight of where the synthesis, the evidence is, what the synthesis is showing us. We have consistently found that across 4 patterns, key elements that we found that were worth presenting today, given that we have a very interesting panel that will provide a bit more insights. Our goal is not present the whole set of factors that are influencing health in youth, but rather just provide a few highlights. At the heart of discussion, of course, is what is it that we need to do differently to accelerate results and reach those that are left behind. What is it that we need to do to ensure sustainability? And more importantly, what is the role that each of us, as the minister just mentioned, right, we should play to achieve such results for youth? And how do we ensure that the voices of youth are elevated and represented in these discussions? Thank you. So looking at the evidence that we have, the first initial pattern of findings that we found is that the results that last come from strengthening national systems, not just delivering standalone interventions. And I think that that's something that we, most likely who are sitting here, know. The second one is how integrated cross-sectoral approaches consistently work better. Better than siloed efforts, of course. This is health outcomes that improve when education, community engagement, and services are connected. The third pattern that we have found is that partnerships matter, and I think that we all acknowledge that that's the case, but not any partnership can lead to strong results. The ones that do are the ones where collaboration is institutionalized, is structured and sustained across governments, with communities, with youth, not just ad hoc partnerships that are one-time options. And inclusion does not happen automatically. We require to reach the most marginalized, we require deliberate designs, targeted investments, and accountability. So in short, we have very strong, I think that we can agree that we have very strong evidence to understand what works. But the question now is, if we know what is working, why are we not seeing the results that we need to find at scale? So for this, the synthesis also has provided some areas that we consistently found as gaps. The first one that we have consistently found is that there's a gap between the design and what gets delivered. So for an integrated approach, although they're widely recognized, they are very hard to implement in practice. A second point is that systems remain siloed, unfortunately. Different sectors, different actors are still working in parallel rather than together. And to the minister's point, I think that it is the time to reflect on that. How do we find a way to work together? The third main area that we found that is the funding and accountability structures often reinforce this fragmentation. So this makes the coordination even more difficult. The fourth point that we acknowledge is that, participation of youth is increasing, right? We have seen more participation. It doesn't always translate into real influence, real over decisions. And that's an important component that we have consistently found in the evaluations that we have seen. Many of these efforts continue to just focus on what has been done and not necessarily on understanding what actually drives the change. Similar elements are observed mental health. So this is an area that have particular very visible challenges. There is recognition, especially in mental health, as a priority. There are several gaps. For example, mental health not consistently being integrated across systems and programs, and most of the approaches remain fragmented. So it's often included in programs, but not treated as a measurable outcome. So we don't always know what is actually working for mental health. There is always limited data on mental health results. We acknowledge that it is expensive to collect that kind of data, but that doesn't mean that we shouldn't. There is an important strengthening to strengthen mental health outcomes requires a stronger national capacity as well, right? As it was mentioned, right? Training providers, finding appropriate services and access to them for youth. These are key elements for not only for mental health specifically, especially. And although the attention has increased, the implementation needs to catch up. So that's what we have found in this initial round of analysis. So overall, the message is from the evidence is quite clear, but the real change is how we translate this evidence, this knowledge, into coordinated, inclusive, and scalable action. And that's exactly what we hope to hear during this discussion. So just to give you a bit of background also on our work on this series of meta-synthesis. This is the last one of a series of 4 meta-syntheses where we focus on the priorities of the UN Youth Strategy. And the previous synthesis, as you can see, focused on education and employment, peace building and resilience, and to amplify the voices of youth. And we hope that they provide a clear picture to deliver results for youth people. So we hope that we will finalize this report hopefully by the end of this month. So we will be happy to share with all of you also for feedback and dissemination if you find it relevant. So thank you very much, and back to you, Pei.
All right. Thank you very much, Tammy, for grounding our discussion today in evidence. And I hope that we took note of quite a lot of things that were mentioned by Tammy, because the basis of this will be guided by what she said, the 4 emerging findings. That's what will guide our discussion today. So with that, we'll turn to our panel discussion. And I know we are pressed on time because we started a bit late. So we'll get right into the panel. So allow me to invite to the stage and, seat, our first panelist, Ms. Zainab Hijazi, who is a clinical psychologist and senior technical advisor for mental health at UNICEF. Our next panelist is someone that I work with, which I'm very happy to see, is Ms. Cecile Mazakurati, I hope I pronounced that perfectly, who serves as a gender and human rights advisor at UNFPA and has also contributed greatly to youth, peace, and security. Okay, I think she stepped out. Okay, very quickly, we'll move on to our other panelist, Ms. Josephine Passanen, who is a research and partnership specialist at UNDP, and she works in the current flagship Human Development Report Office, and she leads the strategic partnerships and conducts research on human development. Ladies and gentlemen. Our other panelist who I will invite to the stage is Dr. Same Kameo, who is a medical doctor by profession and serves as an organizing partner of the major group on children and youth. Dr. Same. Our other panelist is Mr. Puneet Singh Singho, who is a community lead in the Global Network for Young Persons with Disabilities and a co-founder of Billion Strong. Ladies and gentlemen, a round of applause for Mr. Puneet. And last but not the least, we have in our audience a youth delegate from Peru who will invite to the stage Ms. Vanessa Obregon Gonzalez. Please, the seat is yours, ladies and gentlemen. All right, so the panel discussion will happen in 2 ways, right? We'll start first of all by unpacking the evidence that our dear Ms. Tammy presented, trying to understand what it tells us and where the gaps still persist, whether it's in the system, it's in programming, it's in decision-making. That will form the first part of our panel discussion. And then the second part is what can we do? What needs to shift? What needs to change? And I'm so happy that we have senior level officials from governments as well as youth representatives from CSOs and different organizations and the academia here with us. So whilst Tammy was presenting, one of the strongest messages that I got was that the evidence shows that there's an integrated multi-sectoral approach that is applied, and in theory, it works. But when we look at the real world, we still have some fragmentations. So I would like to pose a question to our colleagues from the UN, starting with UNICEF, to just unpack for us, what do you think we are still struggling with, and why are we still struggling to operationalize this, and where are we getting it wrong? So over to you.
Thank you so much, Faith. And hello, colleagues. Really great to be in this room with you. And this is a really important question. And I think the synthesis, it does actually answer it quite directly. And Tammy spoke to some of these issues, and I'm happy to unpack some of them together. Across hundreds of evaluations, across multiple UN agencies and dozens of countries, the finding is very consistent, right? That multi-sectoral system strengthening approaches deliver better outcomes for children's mental health. Now, that part is not new. I think we all know it. We've all been saying it for many, many years. And I think what's striking is that the evidence also shows quite clearly that we are still struggling to operationalize what we do know. And I think we need to, be a bit humble, in my opinion, because it's not simply a question of what we know, it's a question of what we do. And ultimately, the challenge is that systems don't move on knowledge alone. And they move when certain enabling conditions are in place. And very often these conditions are either weak, or they're inconsistent, or they're just simply not available. So to simplify this, I thought maybe I'd cover 5 main issues, some of which Tammy covered. So I'll try to really dig a little bit more deeply into not just what the issue is, but maybe what we should be doing differently. But the first one is about, how we are building around systems instead of through systems. The synthesis shows repeated patterns of short-term project-based delivery that produces results that we can report, but that often don't last beyond the funding cycle. So we're still very much focused on outputs and not focused on projects that support institutionalization, that looking at sustained integration efforts that bring together different sectors and different parts of the house. Second is policy. Policy is not translating into practice. In many settings, we know that policy exists, and we've been advocating for many years across UN General Assemblies, across important resolutions on mental health that are now available. We know that policies exist to support young people's mental health. There are national strategies, there are interministerial coordination bodies and legislative frameworks. The problem is that what is written in policy is often not what young people are experiencing in their communities. And a lot of it is due to limited accountability. Sometimes it's around dedicated budgets. We have very much succeeded in engaging ministries of health, ministries of education, Ministry of Social Affairs. Where are ministries of finance in these conversations? How are we engaging everyone at the national level to ensure that there is commitment and there is buy-in, but very, very importantly, that there is funding for the things that we deem important for young people's mental health. Third is coordination. Partnerships appear everywhere in the synthesis, and coordination is actually mentioned in many instances as a strength. But if you do look more closely, the causal detail is actually very weak. Coordination is described, but it's not always demonstrated in ways that show how it is actually improving outcomes for children and young people. So we do need to be better at building coordination structures that are functional and effective in practice. And also we need to show what the results of these coordination mechanisms are. Fourth, we cannot manage what we don't measure. The synthesis found that across 183 programs that included mental health services, that only 18 measured mental health outcomes. I think that is a very, very drastic finding, to be honest. What we see now is that mental health is implemented widely, but what we don't do is we are not evaluating the outcomes. And this is honestly quite dangerous because we are ultimately not being accountable for the work that we are doing and that we are implementing. So we need to be able to not just simply look at outputs and proxy indicators, but really if we are serious about system strengthening, to really think about how we can start to build in measurement and evidence infrastructure. And finally, my fifth point is around, responsive and functioning systems. Ultimately, they cannot exist without a workforce, a trained, supervised, and supported workforce, especially at national and subnational levels, and especially for children and young people. We know that there is, not enough specialists across all contexts, including in actually development contexts. But what we know for a fact that this is the truth, the dire truth for children is much worse. The WHO Atlas reinforces this, and with a global median of just 1.5 specialized mental health workers per 100,000 children and adolescents. And so for us, we need to be taking more seriously building capacity of non-specialists and community workers, but we also need to be working with governments to build specialized services, because without functioning referral pathways to specialists, we are really only doing a part of the equation, because systems require a continuum of care from promotion and prevention to non-specialized services to specialist care, in order to really be able to take things head on and be able to truly take what we know and start to put it into practice and ensure that we are really truly meeting young people where they are in the communities. Thank you so much, Faith.
Okay, thank you so much, Zainab. And I'm very happy that you've mentioned some critical things like the need for building better coordination mechanisms, as well as noting that we cannot work without an equipped workforce. So in this conversation, I would like to move to Cecile, who's just joined us, and she's from UNFPA. Thank you for joining us, Cecile. And I would like to ask you, Cecile, before we get to the video, I would like to ask you, Cecile, from a service delivery point of view, what does this actually mean, moving from fragmented programs and interventions to more integrated and youth-responsive systems? And I note that Zainab mentioned something about having good workforces and service delivery systems at work. And in this same question, what are some of the biggest bottlenecks that you've identified from your work? Over to you, Cecile.
Thank you, Faith, and apologies everyone for being late. I was just arriving from an ECOSOC Youth Forum session that ran a little late. So I'm so sorry to have missed the presentation of the meta-synthesis, but I have read the summaries of finding, and I think we really are lucky to have this space here to discuss today. So just to add a few points from UNFPA. So I'm Cécile Mazzacurati. I'm the gender advisor with UNFPA New York headquarters. And just to add to the very important points from my colleague from UNICEF, a few things I'd like to flag, building on what you've said. So to move beyond fragmentation, we need to really build ecosystems. And this requires a couple of important operational shifts. We need a true integration of services that put quality and people-centered care at the center. Adolescents provide a window of opportunity for early, well-targeted intervention that can have lasting positive effects. So we shouldn't be asking a 16-year-old to go to one clinic for a flu shot, to another one for contraception, and to a third one for mental health support. So how do we use existing opportunity? For example, if there is an HPV vaccination that's being rolled out in the country, this is already reaching thousands of girls. What more can we provide when we do our HPV vaccination? School health is another good example, where we can really have a better integration of services and referral. Another important dimension, in addition to integration of services, is about adolescent responsive services. And that's very much about building the workforce that we were just discussing. So services need to be available for adolescents, which means there shouldn't be any laws and policies that restrict their access. There shouldn't be age or marriage restrictions. There shouldn't be requirement for third-party consent to obtain services. The services should be accessible. It's one thing to have services available, but they need to be accessible to adolescents. And we know here the barriers is service location and cost, lack of information, and stigma. Services need to be acceptable. If a provider scolds a young person for being sexually active or dismisses their anxiety as just a phase, the system has failed, no matter how many services it offers. Services need to be equitable. All adolescents need to have access, not just a select group. And, excuse me, services need to be appropriate and effective. So the right sexual and reproductive health services, the ones that adolescents need, should be provided in the right way, in a way that is empowering and respectful, and that puts their wishes at the center, in order to make a positive contribution, right? So we know that integration works, but it's hard. And the meta-synthesis and our field experience from UNFPA point to a number of challenges. So we also mentioned multisectoral coordination. It's critical, yet it's very difficult to implement. It is really challenging, and many interventions that could be effective fail because they're unable to successfully do this multisectoral coordination and deliver these multi-component interventions in a way that is really integrated rather than piecemeal. It's very difficult to get immunization programs, school health programs, and SRH programs, for example, to work together. Couple more things I just want to briefly mention. Funding challenges. We also just heard about that. Most funding is vertical. So funding is earmarked for HIV, or maybe it's earmarked for maternal health, or it's earmarked for nutrition. And it's really difficult for a local clinic manager to bring these different funding streams together to provide one integrated services. So the system is budgeted to be fragmented. And the last point is about the data challenges. If we don't count, if we don't have the data on young people, well, they're simply invisible. And we know that very often our data systems look at people or women, for example, of reproductive age from 15 to 49-year-old. So what happens if you're 17? What happens if you're a younger adolescent, 10 to 14, but you do need access to your health services? So I'll stop here. Thank you.
Okay, thank you very much, Cecile. So before we continue with the panel discussion, we would just like to show you a quick video from UNICEF on a young person expressing himself about youth and mental health. So I think the video can go up now.
Therefore, I call on all global leaders, all able world leaders, to take action and foster a society where children and adolescents are emotionally empowered to thrive.
Sorry, it will start one more time. It's just a 1-minute video. Yeah, could you play again, please? Tammy, could you just press play? Yeah. Okay, just one moment. Okay, we can play the video at the end. It's also fine, in the interest of time. So I like what Cecile mentioned about measuring and the importance of data, because we have within our midst one of our panelists, Josephine, who, like I introduced to you, works on research related to human development. Now, one of the key findings that Tammy presented, another one that really stood out, was that whilst mental health is widely included across programs, right, it's rarely mentioned as an outcome. And I think Zainab also introduced that part when she was giving her interventions. So I want to find out from you, Josephine, from your perspective, working in the UN, working in research related to human development, we often put mental health as something that can help through an integrated approach to improve outcomes in education, improve outcomes in protection against violence. And if we don't measure mental health outcomes, how do we know what's working? How do we know which interventions are actually producing results, and what needs to change in order for us to have programs that can actually move the UN programmatic work forward and produce actual visible results?
Thank you. Thank you very much for the question and for having me. Thanks to UNFPA and UNICEF for organizing this very important conversation. And for the minister, thank you for opening up our conversation and showing also, you know, the political engagement in these issues, which I think are key. So what I wanted to do is to sort of take a step back and look a little bit at the global picture when it comes to mental well-being, and specifically focusing on youth mental well-being. So first of all, as you mentioned, of course, it's mental well-being is a driver of development outcomes as education, protection, violence prevention, social cohesion, and a lot of these things. And as Minister Agüero noted, investing in mental well-being is also investing in development and in resilience. But it's also an outcome in and of itself, right? And this is a key message that is coming out from our recent series of UNDP Human Development reports, starting from our report that we put out in 2021 or 2022, throughout the most recent report on AI and human development. I brought a few copies here if anyone wants to take a look. And what the global message seems to be when we look at this data is that we live in a world that is increasingly worried. People report much higher level of stress. People report feelings of insecurity. 6 out of 7 people globally report feeling insecure on some aspects of their lives. And this is happening in parallel when the world is sort of progressing on more objective development indicators, if you will, like our Human Development Index. On average, we're doing better when it comes to material standard, education, health, or, you know, life expectancy and those types of things. But it doesn't seem to necessarily translate into more perceived feelings of a better perceived mental well-being. So this is a very sort of troubling pattern, of course. And it also suggests, as you were saying, that development metrics doesn't really capture everything. And if we fail to measure mental health and well-being, we do risk overlooking a major dimension of progress. So we found, for example, in our 24 report that feelings of insecurity are linked to higher levels of polarization, weaker trust in societies, more difficulties in addressing shared global challenges. And of course, that can directly undermine development progress as well, right? So this is a critical area. And among young people, the evidence is especially concerning. So we conducted a lot of research with partners at Dartmouth College, University College London, and Sapiens Lab to see what's going on when it comes to youth mental well-being. And what we found is a sharp decline in youth mental well-being across the world. And this has sort of reversed a pattern that used to be stable up until 2007, more or less, where when we were younger, in general, younger people tend to be happier. Then we work, we're in middle age, and we become more depressed, and we have a lot of pressures on us, and we report lower levels of mental well-being. And unless we retire, we become older, we become happier again. This used to be stable across the world, across many, throughout the years. And this pattern has completely collapsed. So young people today report much lower levels of mental well-being than older people. It is a little bit more prevalent in the Western high-income countries, but we are seeing it in Latin America, in Africa, in Asia Pacific, in Arab states as well. Not as pronounced, perhaps. So here's also an opportunity space for policy to get ahead of the curve and really take this issue serious before it becomes as infested, perhaps, as in other contexts. Part of the trend seems to be linked to the rise of digital technologies and sort of widespread use of smartphones, AI-powered social media algorithms, and so on that are geared towards maximizing engagements. They build kind of addictive patterns and so on. But at the same time, the evidence is nuanced. It's not that all digital is bad. Digital tools can strengthen connections. It can help with peer support, access to information, and so on. So the issue is perhaps not technology itself, but how it is developed, how it's deployed, and how it's used. And this is something we look at in this 2025 Human Development Report on AI and human development, and really dig into how we make choices so that these technologies are something that serves human development and not sort of undermines it. And this is really why measurement matters so much, right? So when we don't measure things, they risk becoming a policy blind spot. It's also about equity. We know more about what's going on in higher income countries simply because there's more data from these countries. So this is also an equality issue, right? And then finally, I think as was pointed out here several times, partnerships are key. And one thing we did building on this report was to bring together global leaders, policymakers, CSOs, private sector initiatives at the Dartmouth College on a global symposium on what works in youth mental well-being. And my colleague here said, you know, where are the ministries of finance? They're critical. And one of the highlights from that symposium was actually that in India, the chief economic advisor is bringing these issues into the annual economic survey because they're realizing this is something that's impacting productivity, it's impacting development prospects. So they're starting to measure it, but we need, again, to bring people together from different sectors and not necessarily just the ones who are already working on mental well-being, to really make sure that this is something that is measured and then integrated in the core of decision making and not seen as something that is fringe, so to speak. So I'll stop there, but happy to share more from the report. And again, I have a few copies if anyone's interested.
Okay, thank you very much, Josephine. And colleagues, if you are, I think they can access the copies as well online, right? Yeah, so I'm sure after this meeting, when we're sharing the post meeting, we could include it as one of the links. Thank you so much, Josephine. Such a very rich intervention. So listening to the UN, I think personally, I now want to hear from the young people and the representatives from the youth organizations. So allow me to ask if a microphone can also be passed to Puneet, please. Puneet is next to you. Yeah. Thank you. So I would like to pose a question to Puneet, building on what has been mentioned by UNFPA, UNICEF, UNDP, as well as the findings that we have, whilst we are discussing this topic of measuring mental health and the fact that it's not being well captured, so we don't know what's working, we would like to find out from you, if these mental health outcomes are not being measured, who do you see being left behind the most or invisible? And also, what would it take to make sure that measurements actually reflect the experience on the ground of these people, especially those who are facing exclusion? Over to you, Mr. Puneet.
So, coming from a slum in India and being a domestic violence survivor and someone like who has non-apparent disabilities, in the beginning of my career, there were a lot of organizations that used to come to my neighborhood, and they used to have that kind of approach that that we know what you want, we know what you need, and from uh, that irritation and that frustration, I always wanted to start something on my own. That okay, I want to do something, and I think I can do better than that. So with that, I think with that arrogance and with that overconfidence, because you are not listening to us. You have that presumption that that someone from a particular marginalized community, they we know. So I think that kind of approach is also, I always say that beyond, data is not my area of expertise, but I can say that listening really helps. Just listen and and design the system and the process with the important stakeholders that you are claiming to work with. And just a few observation I would like to share that. When we talk about the digital world, I have built a lot of communities, persons with disabilities, neurodivergent youngsters. And, in that kind of scenario where we have TikTok, where we have Instagram, even like one comment, one ableist comment, one kind of comment, which can, really ruin your day, your week, and even can give you like chronic stress. One comment, and from that nudge we started our own platform, at the in-house platform, that global network of young persons with disability. And we have built a community where we are supporting each other. We are like having that kind of support system where we are like sharing, where we are caring for each other. So I think digital world has its own limitations, but it has its own how we use it. So I think for me, you have asked that, why it is not working. So I think designing with the community is very important, and also the language, that we use. We often have a very, we're always talking and debating about the language. In the as activists, we always say that this is the better term to use. This is a good term. We are evolving as a, as we are using the words, and words has like a lot of power. I think we have to shift from a language to architecture as well. We can have put the core idea of inclusion, because sometimes we are just focusing on efficiency. And, me as, as a founder, now I'm like find myself focusing on skilling. And few years back, I was saying that, okay, let's listen. So I think I often laugh at myself as well, that what I'm doing. So in the end of the day, we must ensure that equity should come before efficiency and scaling and speeding up. And we need to like slow down as well when it comes to working with the marginalized communities. Yeah, thank you.
Okay, thank you very much, Puneet. So building on what you mentioned about listening and making sure that young people actually heard, instead of, yes, there are things that worked and we want to scale, but then we stop listening, like you mentioned. So I'll mention that from what Tammy presented earlier, one of the findings surfaced that partnerships and participation are a success, but the evidence also suggests that youth influence is limited. Are we really listening? Are young people being heard? Yes, you are scaling up programs. Yes, we're scaling up interventions, but are young people being heard? So I'll ask Dr. Same, Dr. Kamel, from your perspective, from the major group on children and youth, are youth at the table actually shaping decisions, influencing decisions, or are we just overstating our progress?
Excellent question. Thank you very much. So let me start by asking you a question. You know, we're not even 30% through the year 2026, but boy, what a year, right? We've seen it all. But what about the past 5, 6, 7 years, right? We've seen pandemic, we've seen wars, genocide, starvation, famine, economic instability, energy crises, and the list goes on. The triggers are there more than ever, but let's acknowledge that we're not simply managing health as traditionally as we used to anymore. Today's youth are carrying the weight of emerging, intersecting pressures. In addition to that previous list, we're also navigating a global mental health crisis, systemic social inclusions, widening economic uncertainty, rapidly shifting digital environments, and the undeniable psychological and physical stressors of climate change. So let's take a look at what the United Nations says. The youth strategy of the Secretary General of the United Nations recognizes that sustainable development is entirely impossible without securing the health, mental health, and well-being of young people. But recognizing this is only the first step. Based on all of the above, if we provide a young person with the mental health support, but return them into the same environment of severe economic instability or social inclusion, the health intervention cannot hold. The evidence is abundantly clear. We must address the health of young people holistically. This brings us to a crucial finding from the synthesis. Mental health does not exist in a vacuum. They are deeply intertwined with education, employment opportunities, and robust social protection. Let's start by education. Schools are not just centers for academic learning. They're primary ecosystems for health promotion. The evidence shows that when health, physical health, and mental health services are integrated into the educational system, that dramatically reduces stigma and increasing accessibility, outcomes improve dramatically. Employment. Economic uncertainty is a primary driver of youth and anxiety and depression. Right? Do you agree? Programs that combine skills training and labor market insertion with psychological support demonstrate significantly higher success rates. A decent job is in itself a mental health intervention. Social protection. Youth, particularly those in marginalized communities and groups, often fall through the cracks of social safety nets. The evidence demands that we design inclusive services that actively reach out to those people left behind. That's what the SDGs are about, right? Leave no one behind. If we want to advance the physical health and mental health of young people, it's not only about the health ministries, right? They need to work in silo with all the ministries, education, labor, youth. Everyone needs to work together, and we need to finance these ministries to enable them to, do better interventions for the mental health of young people. So how can governments and the UN agencies better integrate youth voices? Well, first of all, we must stop viewing young people as merely the target audience. No. Or beneficiaries. Young people are experts in their own realities. Lived experiences is a rigorous form of evidence. When youth are brought in as co-designers, co-implementers, and co-evaluators, which is why the work of networks like Eval Youth is so vital, programs are inherently more relevant, more trusted, and more effective. There's a very famous saying that says, from youth to youth. This is exactly what we want to do. If a program is designed for youth without having youth co-designing, it's structurally flawed. To adopt interventions across different global contexts, we must hand over the microphone, hand over the pen, and frankly, hand over a share of the budget to the youth-led organizations. I'll stop here. Thank you.
Thank you very much, Dr. Kamel. So we are pressed on time, and I want you all in the audience to have at least some time to ask questions and just engage in this discussion. So we'll progress to the second part. Remember, I said that our panel discussion starts with us unpacking the evidence as well as what bottlenecks still exist. And I think you've heard from the panel so far, quite a number of things have come out. And I'm really grateful that they have not held back and just expressed comprehensively these critical issues. So moving to the next part of this panel discussion, we'll unpack what needs to change, right? So we heard from the evidence that was presented. Again, I keep giving a shout out to Tammy for giving us the evidence earlier. And we see that it suggests that the trend, the strongest systems that are there are aligned properly across the different sectors of engagement. But we also see that there are barriers, noting that we cannot work in silos. Dr. Same mentioned that mental health is not it can't operate as a single issue. It operates in different spheres, and I'm so grateful that you mentioned it. It affects health, it affects employment, it affects education. So the question remains, what do we need to fundamentally change? I'll ask each of the panelists, first starting with the UN, to briefly give us an intervention. I'll ask that you limit it to 1 minute so that we catch up on time. And starting with Cecile, the integrated approaches that we have, especially with community engagement, and we recognize that these help health results, key health results, would like to find out from you some of the institutional challenges preventing the UN efforts from actually achieving results. What are those barriers? And in 1 minute, if you could give us an intervention. I don't know if you have a mic with you. Yeah, over to you, Cecile.
Thank you. Okay, it's a tough question in 1 minute, but I'll try to summarize my points. So we know from the meta-synthesis that we have the technical recipes. We're not seeing change at scale because we tend to treat youth health as a series of projects rather than a systemic obligation. So we have a whole lot of well-funded boutique projects that are never that never connect because funding and policy for scaling up are missing. So in a way, we're a pilot rich but system poor. We're technically proficient but institutionally fragmented. So the problem is not technical. It's rarely technical. We know how to train counselors. We know how to integrate mental health into schools. We have the how-to in the meta-synthesis. The problem is fundamentally institutional because we have a silo problem. Health ministries own the health budget, but the youth are in schools. Mental health is often an orphan sector. It's too medical for schools and too social for hospitals. And I already mentioned the question of vertical funding, which prevents horizontal integration. And ultimately, the problem is political. And political cycles are 4 or 5 years, right? If you think of elections, mental health outcomes take a decade to show economic return on investment. There's a stigma gap. Investing in youth mental health is seen still by some as a luxury or as sensitive compared to building roads or hospitals. And as we've just heard, there's also a voice gap where young people are often invited to the table for consultation, but actually have very little authority on decisions. So what needs to shift? I would just want to point out to 3 specific shifts. First, we need to shift from project funding to system financing, move away from the 1 or 2 year donor-funded pilots, but move into integrated budget lines where the Ministry of Finance, which was mentioned earlier, rewards education and health for joint outcomes in youth well-being. We need to shift from siloed delivery to platform-based delivery, where we don't create new youth clinics, but we use the platforms where young people already are, school, vocational centers, digital space. And then we need to move, that's the third shift, from youth-informed to youth-led architecture. And really resonating here with what the meta-synthesis highlights as the importance of community engagement as an enabler. So our problem is not the knowledge gap, it's the accountability gap. We must stop asking youth to navigate our complex institutional silos and really force our institutions to navigate the complex lives of young people instead. Thank you.
Very much, Cecile. And quickly, I'll turn the floor to Josephine from UNDP as well. If you could provide us with your perspectives and on what the question that I posed to Cecile, on what we can do and what needs to change in the development context and how the UN needs to adapt to ensure that we deliver on the SDGs and system level results, particularly on youth and health. In 1 minute, please.
Thank you. Yeah, it's a huge question in 1 minute. So I think what I'll say is highlighting from my previous intervention, we need to take measurement of subjective well-being seriously and integrate that within how we're also evaluating development progress. Because if we're not measuring and understanding what's going on with subjective well-being, we have policy blind spots, and we risk not only not understanding why things aren't working when it comes to mental well-being intervention, but also not understanding why things aren't working in other spheres. As we heard, mental well-being is so connected to things like productivity, health, education, and so on. And then again, as many people have said here, working in partnerships across sectors, across actors, with youth at the center, youth as leaders, co-creators, not youth as sort of token participants in a discussion, but youth as experts. And UNDP is doing quite a bit of work in this space. Recently, we've launched a series of innovations when it comes to youth sports and linking that to things like mental well-being and other development interventions or development dimensions. So this is an area that we're working in, trying to be that platform that connects across partners and that connects across silos. But it's something that is, I think, emerging and needs to be much more brought into the core of how we think about development.
Okay, thank you, Josephine. And over to you, Zainab. If you could also build on what has been mentioned by Cecile and Josephine, especially from the UNICEF point of view, what can be done better, especially in the UN and the programs that UN is implementing?
Yeah, thank you so much. So, I think the case has been made, right? We know that the economic case is clear, the human case is clear, and we know enough about what works. There are enough evidence-based interventions from prenatal care to early childhood to middle childhood to adolescence. We know that there are enough evidence-based interventions across that promotive, preventive, and treatment continuum. The problem has been scale. And what UN agencies need to do better, and I can speak from the UNICEF perspective, and we acknowledge this as an issue, is that we need to be better able to fulfill our mandate in working with governments. System strengthening means working with governments so that the accountability lies with them, not with us to inject resources and funding. We need to be able to provide and backstop support, but the intent and the long-term kind of North Star needs to be government's own accountability. One thing that we've, successfully done over the past, I would say, 5 years is making sure that mental health is not seen as a health issue. So ministries of health are more actively engaging with ministries of education, Ministry of Social Affairs. There are interministerial bodies that are being created in certain countries that are helping to advance young people's mental health. And for us, what remains true is the best investment that governments can make is investing early in child and youth mental health. We keep talking about this global crisis, but what we need to be doing is not just reacting to the crisis. We need to be enabling and supporting governments through workforce, through national level financing, so that they're able to get ahead on these issues and start to integrate very simple things into schools, into primary healthcare, into community-based services, so that the young person who's struggling with their mental health does not reach a point of self-harm and suicide. And one last point I will say, we are far from where we need to be. There are many countries who are still criminalizing suicide, and UNICEF and UN agencies and our partners and implementing agencies need to be better at advocating and working with governments to decriminalize suicide so young people feel safe in getting the help that they need. Thank you.
Okay, thank you, Zainab. We'll move really quickly to the topic on inclusion that Dr. Kamel introduced earlier. And one of the things that came out again strongly in the preliminary findings of the meta-synthesis is this issue of inclusion, right? So I would like to find out from you, our youth delegate from Peru, if you could tell us from your experience, from your country and just in general, what makes youth voices heard and not just symbolic in shaping policies and programs? And also, where are we still falling short, whether it's the UN, academia, because I know we have representatives from different academic institutions here as well. So where are we falling short and what can we do better? I hope the question is clear.
Yeah.
Okay.
Good afternoon. Well, it's really a pleasure to share this panel with such incredible people. And as one of the 3 youth delegates of Peru, I would like to echo here the voices of young people who experience increasing frustration because of one reality. Sometimes our participation is often trapped in an official photo. And moving youth voices from symbolic gestures to actual drivers of policy that we were talking about requires intentional design and a fundamental shift from institutions that share power. So from our experience in the National Secretariat of Youth in Peru, we have learned that youth influence only becomes meaningful when it becomes beyond one-off consultations and becomes a permanent fixture of the state. And we see real success when we focus on 2 structural shifts. First, the continuous engagement. I think we see the strongest outcomes when participation is formally linked to decision-making. And through our national organizations, youth, we currently articulate nearly 2,000 groups across Peru. And notably, we have to highlight that 64% it's female leadership, and we integrate them into regional youth council. It's something to be really important. And this, I think, this institutionalizes their voice, making it a formal governance mechanism more than an sporadic political favor. And second, I think shifting from passive beneficiaries to active co-creators, we saw this clearly in our response to the youth mental health crisis through initiatives that we have in our national secretariat. It's the project of Agent of Change project, Agente de Cambio, and adolescents stop being treated as passive patients and were empowered with their community change agents. And I think when engagement gives youth actual agency in their territories, the outcome are incredible resilience. But regarding to the question, where are we still failing short? I think if we truly committed to the UN's mandate of empowering the youth, we have to be completely candid about where the system is still falling. And I think this panel has stated that perspectives. Number one, I think the barrier of tokenism at implementation. I think we are really acknowledged about that topic. And number two, partnerships versus actual influence. I think we rely heavily on institution partnerships to improve services, but sitting at partnership to a table does not guarantee that a young person's voice actually carried weight to the final outcome. So present does not equal powered, and we need to measure our success, of course, not by how many youth are consulted, but by how much decision-making power they actually held. So that's it. Thank you so much.
Wow, thank you so much, Vanessa. I really like what you mentioned about present does not mean power. That's a very, very powerful statement, actually. So before we open up the floor for Q&A, I would like to recognize the presence of the Assistant Secretary General on Youth Affairs. He's here with us, so just a big round of applause for him. Thank you for joining us. And I also like to recognize the presence of the Minister of Youth from Sierra Leone, Mr. Ibrahim Sano. A big round of applause as well for him. And before we get into Q&A, I just want to request the Minister of Youth from Sierra Leone to give us a few reflections from his country on youth and health within 2 minutes as well, if a mic can be given to him. Because we heard also from the minister from Paraguay who gave us our opening remarks for today. So over to you, sir.
Thank you very much. I wonder what 2 minutes will do for a politician, but I'll try. Thank you, my colleague minister. The name Aguero is a name I didn't like for quite some time, but today I will begin to like it again because Aguero played for Man City and he deprived us from winning the Premiership one time. Felipe, thank you. You recently just visited Sierra Leone. Your question is quite impactful and great, not just in the context of Sierra Leone, but in the context of the African continent as a whole. Of course, you know, Africa constitutes a very broad and large youth population, and mental health, it's really predominant and it's affecting socioeconomic development paradigms as a continent. But in the context of Sierra Leone constitutes about 72% of young people with a median age of 19. And that tells you that we are a younger population, we're a greener population. Faced with so many challenges, Sierra Leone is also a post-war torn country. We had about a decade-long civil war that's accounted for a lot of atrocities. And then we've had the scourges of Ebola and then the other pandemics like COVID. But that notwithstanding, the state of the mental health, it's quite challenging and increasing daily. And I want to just reinforce some of the points made, especially by Kamel. This one is a shared predicament. So what we have to do in connection to the topic on ground is the fact that collaboration is not just a word that we need to speak, but it should be a verb that we need to reinforce with an action, wherein the collaboration has to start with the UN, with the resident UN agencies on ground first. They should have collaboration among themselves to ensure that they have a clear-cut mandate in terms of their approach, in terms of also their AWPs, in terms of how they also integrate. Because it is only when they have a clear-cut mandate or a clear or forward-looking paradigm in terms of policy shifts, then they can now have the government officials cooperated or co-opted into what should be done. So I'll summarize with this. Currently, we are facing with a drug and substance abuse called Kush, which has accounted for several loss of young people. Prior now, before it was declared an emergency, we were having at least 1 or 2 young people dying a week. Yes, and so when, as Minister of Youth, I had to rally around some other colleagues and then engage His Excellency the President, a listening and caring President, and it was declared as an emergency. But why am I saying this? Because, like I said, our predicaments are shared. The Kush we have in Sierra Leone, it's also in Guinea, it's also in Liberia, it's in Ghana. And this is like, it's not a normal drug, it's a synthetic drug that kills very, very fast. It affects the liver. They have excruciating and unbearable sores, and then they are all like rejected. So they had to move on the outskirts of the city where they will live. And one of the painful moments is, and this is, I'm happy that UNICEF is here. It's like you go there, you see girls who are between the ages of 13 and 16. They are living there, and they are really in their majority. And these are girls who were brought from the villages to the cities in a bid to care for them, and then their caregivers, whatever happened, they had to, just leave them on the street. So we need the word collaboration, but we need to enforce collaboration. When enforce is not the right word, we need to see how we can make collaboration an actionable one, and then see how best we can have the UN agencies collaborating among themselves, and then with that they can have the government of offices being integrated, supporting and reinforcing Camel's point. But thank you very much.
Very much, Mr. Ibrahim. Another round of applause for Mr. Ibrahim, ladies and gentlemen. Okay, we'll now move on to all of us being part of this conversation. I see a hand already up there. We now move to all of us as part of this conversation. We've heard the discussions by the panelists, we've heard the evidence, and now over to the audience. So you can ask, you'll be given the floor to speak once you receive a mic and you receive my directive here. So we only have a few minutes because we started a bit late, and we'll start the first question from, because I saw that hand first over there. I think she knew that we're entering into Q&A. So you give us your name, which institution you are coming from, and then your question within a short period of time, and then we'll give the panelists to respond. Thank you. Over to you.
It's an absolute honor to be here. I'm Ananya Banerjee, a social activist from India, representing my own organization as I work on mental health on ground, which is Yuva Sarthi Foundation. And I'm based in Australia, where I'm also part of Parliamentary Consultation Group. And I have a question, while I also have a quick comment, that I feel we can't be looking at mental health in isolation, as we talked about, because it's hypocrisy that we overlook climate change. We don't talk about wars and genocides. We can't be giving a diagnosis to a domestic violence victim and telling her to journal. So I feel like we have to move from self-care to community care. And I would love to hear from panelists that what it means for you to promote community care, and how can we do that more than just checking on your friends, how policies can be brought into it. And how can we have better accountability from the governments? Because when we make policies within the short electoral cycle, we think about next 3, 4, 5 years, overlooking the impact it would have on future generations, especially the well-being. Thank you.
Okay, thank you very much. Your name is, remind? Ananya. Okay, and you're from? Okay, thank you very much, Ananya. We'll take 2 more questions, and then we give the panelists. I'll take from this row. Yes, and then this row, and then, yes.
Okay, thank you very much. I'm Youth Delegate of Japan, as well as representative of G7, G20 Youth Japan. Thank you very much for panel discussion. It was very inspiring. I'd like to ask about measurement, which was mentioned several times. I used to work for UNDP in Tokyo Representative Office as well, but I find it sometimes quite difficult to evaluate if the international policies or what we are doing is actually making impact in that, like in the national policies, especially in this mental health. It's not easy to measure. Like it's not, the people in Japan is now 30% happier. It's not this simple. So would you be able to give a little bit more like specific or concrete idea of how we could measure if the national policies are changed, or if the impact is, actually measurable? Like, could you give us some idea about that? Thank you.
Okay, thank you. The next question here, and then here.
Hello, everyone. My name is Abir Al-Harithi, and I represent Sigma Theta Tau, an International Honor Society of Nurses. We have a lot of youth that are currently relying on AI-powered chatbots to engage in mental health conversation and seek mental health support. While that can be beneficial, it can also be harmful. I wonder if there are any frameworks or national or global frameworks that are being developed or synthesized to ensure the accountability and safety and the clinical oversight, especially for these minors. Thank you.
Okay, thank you for that important question. And one more question on this side. Yes.
Okay. Good afternoon, ladies and gentlemen. My name is Desmond Pesima, and I'm a presidential advisor on youth affairs, government of Sierra Leone. By the way, Camille, I really liked your presentation, and I'd like to have your script, at the end of the program. Really, it's been an interesting conversation, and talking about youth well-being and mental health, I think we have to look at it from a holistic approach, bringing all sectors, all aspects of society to ensure that we really tackle the problem. And I believe, nutrition plays a key role. We're talking about health, and nobody's mentioning about how do we fund or facilitate balanced nutrition, in our economies to ensure that the agricultural sector is producing, food that is good for the body with all this, genetically, produced food. And another key issue, again, that is very important, which is contributing to mental health issues, is social media. All right. Social media is can be very toxic nowadays. We see young adolescents suffering from cyberbullying on the internet. They go into isolation, they go into depression, and they come out. That is why some of them engage in suicidal behavior. So we want to see how the United Nations or other developmental partners within countries can work together and see how best we can address some of these challenges. And for us in Sierra Leone, as the minister rightly said, yes, we are grappling with so many challenges, but the government is really making tremendous efforts, to invest in things like nutrition, invest in education, even in healthcare, because the president believes that, for a nation to be developed, the human being has to be very much healthy, physically, mentally, emotionally, and socially. Really, for me, it was not a question, but just to add my voice to some of the conversation and ask that I would like to have Camille's script at the end of this session. Thank you very much.
We'll see if we can sell it to you. Is that okay? Maybe we can copyright it, eh? Okay, we have one question online from Nicole. So Nicole, if you could just quickly be given the floor to speak, unmute and give your question.
Thank you so much. I hope everyone can hear me.
Yes, we can hear you, Nicole.
So my name is Nicole Barth, and I'm the local representative for Youth for Human Rights International. I just want to start by saying thank you so much to everyone for being here and for holding such an important event. And really my question is to all of the panelists, all of the attendees, because I am deeply touched by what you're saying in terms of a multifaceted approach to handling a young person's mental well-being. I completely agree with some of you who have mentioned a person has to feel safe and has to have access to education, for example, in order to begin approaching their quality of life and mental health. And really my question is, do you feel that the implementation of human rights education at a governmental global level across the board would help facilitate the mental health and the empowerment of young people?
Okay, very good question, Nicole. So I'll give the floor to the panelists to respond. I'll start with the question on community engagement that we got. And that one, I will ask Dr. Same to please briefly give us a response. I hope you managed to capture the question. Over to you.
Yes, I did. Thank you very much. And thank you, Anania, for the question. So I can build on what I already mentioned. The solutions can be divided into three things. First, the de-siloing of the funding. The funding cannot be just to health, focused on health, but health must speak to education, must speak to labor, must speak to employment budgets. It must speak to everything. And I would just briefly mention that recently I was talking to one of the ministers in one of the countries, I don't want to name names, but we were talking about something related to mental health and education. And it's clearly an education thing. And he's like, no, but that's not me. You need to talk to the Ministry of Health. And then I actually did go to the Ministry of Health. They're like, no, you need to talk to education. So, you know, the siloing of the funding cannot continue that way. Second is institutionalizing the engagement of young people. There's a saying in Arabic that one hand cannot clap alone. So you need to unite with other like-minded youth organizations, not just, as like an ad hoc or tokenistic participation, but actual participation that, legally and procedurally embedded into the policies that are being designed and evaluated. And last, the prioritization of mental health parity. Mental health and psychosocial support must be treated with the same urgency, funding, systemic integration as the physical health. I know I'm a doctor of physical health, but also mental health is very important. So thank you.
Thank you, Dr. Sameh. For the second question on measurement, I think this one goes without saying. The question is directed to UNDP, and I'll ask you to give your response. Ms. Josephine, over to you.
Thank you. And thank you for that really important question. I think what you're saying is how can we understand if countries are progressing and how can we measure if policies are having an impact? And of course, I mean, there's a number of sort of evaluation frameworks and standards for impact evaluation and so on. But the broader picture here, I believe, is that we need to think about the benchmarks against which we measure progress. So currently in development debate and politics and economics and so on, we still tend to focus very much on GDP and GDP growth, which is important. Material standards are important, but it doesn't measure the full scale of what matters to people. So at UNDP, what we do is we put out the Human Development Index that tries to measure, and you know this very well, having worked in Tokyo, trying to measure how countries are doing when it comes to health, education, and material standard. But even there, as I was alluding to earlier, that might not be enough either, as we're seeing that even though we're having some progress on these metrics, when it comes to subjective well-being, it's not following the same trend, and there seems to be a certain divergence. So we really need to think hard about what are the standards, the benchmarks that we use when we measure progress and we think about how countries are doing and integrate that into the decision-making cycle, into the policy debate. Because without that, it will be hard to gear policies towards what really matters for people, I think.
Okay, thank you, Josephine. Very quickly, our third question was around how that the use of technology, young people are using AI chatbots, and the global frameworks for accountability. That third question, I'll pose it to Cecile, if that's okay. I don't know, did you manage to get the question, Cecile? Or would you like her to repeat it?
No, I got the question.
Okay.
I just don't have the answer. It's a really interesting and important question, but I actually don't know.
Okay, that's okay. Okay, sure, Zainab can go. Thank you, Cecile, for the honesty. That's what I love. See why I love.
I'm not sure I have the answer either, but I have some thoughts at least. No, so thank you so much. I mean, I think it's such a big issue that is front and center. UNICEF is grappling honestly with this issue. Countries are reaching out to us. And I think it does really link with the question around social media as well, because we're really learning from those two experiences. You know, young people are experiencing the world in their own way. They are on social media, they are, using AI. So what do we need to do is we need to have policies in place that protect children. And that needs to be done at different levels, right? So young people themselves need to be empowered. They need to have the skills in order to navigate AI or social media. And this needs to happen in schools. It needs to happen at home. And parents as well, they need the skill. A lot of parents come to us and they say, well, what do I tell my child whose friends are using social media and they want to be on there? And what do I do? We need to be able to have conversations to enable parents to be able to build the guardrails within their own homes. But it's also not on the onus of children and parents alone. I think it's really unfair. We need to be able to push governments to ensure that there are certain policies in place that protect children online, and for them to push institutions and companies and social media companies and Facebook and all these different institutions, because they're the ones who are kind of monopolizing the world that these children are trying to navigate, and they are instilling these algorithms that are addictive in nature. Things need to change at the source. The problem, and I think we need to all be careful about, and UNICEF's Initienti, our Office of Research, just released a report on children and social media, and I really encourage you to think and take a look at it, because it does capture that nuance of what is good and what is bad. It also captures the risk of certain governments now putting a ban on social media for young children, because what that drives children to do is actually try to access harmful ways and channels of accessing social media, which actually puts them at further risk of receiving harm and violence, and even putting harm onto others. So you asked if there are tools and protocols. There are frameworks. We have developed frameworks on what needs to be done, and we need to be able to implement them with our partners and with governments.
Okay, thank you, Zainab, for biting the bullet on that very, very important and still complex question. So the last question that we received, which I'll ask our youth delegate from Peru to respond to, which is around human rights and how that interventions that support human rights across the board can help improve health outcomes for young people. Over to you, Vanessa.
Yeah, very quickly. I think the question relies about safety requires trust, and right now many young people, especially my country, I have to say that there's 2.1 psychiatrists for 100 inhabitants. So it's sometimes we do not trust that government will protect their data. And I think their identity and their story when they seek mental health support, it's also important to highlight. But I actually do not have the right answer for this, but I still rely on the question, no? That safety requires trust. So I think that's our perspective for now.
Thank you, Vanessa. I know we are pressed on time, so we need to wrap up real quick. So let's give a big round of applause to our panelists as they take their seats back in the audience. Thank you very much. And with this rich discussion that we've had and the good presentation that we started with, ladies and gentlemen, it's my great privilege and honor to invite to the podium our Assistant Secretary General on Youth Affairs, who will give us the closing keynote remarks. Please, Felipe, over to you.
I'm okay. How are you? Good. Great. Good afternoon, everyone. I'm very pleased to be here. Ibrahim, nice to see you in New York. We were together in Freetown just a few weeks ago. Thanks, especially, first of all, UNFPA and UNICEF for their leadership on this evaluation series on Youth 2030, trying to really have a process every year, bringing evidence data in terms of how we can have better initiatives, policies, programs, and services when it's about working on youth. And I'm very pleased that this year focus has been health and specifically well-being, no, and with mental health at the very center as a very critical emerging topic across communities. I really want to recognize also the work and also the partners that came together to have this event here in the ECOSOC Youth Forum, UNFPA and UNICEF, of course, but also UNDP. UNDP is doing a lot on this topic, I have to say. Every time I visit countries, there's a lot of action happening in support of governments. I remember very clearly one of the first country visits in Thailand in terms of how to support the government when it's about also innovation in terms of addressing these topics from governance. But also, of course, WHO as a central part and piece of the UN when it's about health policies. And Eval Youth, the Federation of Medical Students Association. I'm a former student of medicine, I have to say. So pleased that also this organization is so present in global discussions, and definitely the Mayor Group of Children and Youth. That is one of the key drivers of this youth forum. And it was great also to have one of the global organizing partners as a panelist. No, like the conversation on mental health and well-being it's one of the most critical ones for youth. For the current generation, but also for future generations. And that's why also I think we're seeing young people mobilizing themselves at the community, pushing institutions to have not only more investment on a topic, which is very underfunded. When we look into global health investments, the investment on mental health is really a marginal one across countries and regions. But also, I think what young people's vision and way of understanding this topic is also very clear. It's from a very different angle, and that's why the breaking silos is so critical to advance this agenda. No. And I have to say that every time I have a possibility to join an event on mental health and well-being, I will be there, because this topic really resonates a lot, not only in my role in the UN now, but also at the personal level, I have to say. Because some years back, when I was the head of the Youth Affairs Agency in my country, in Uruguay, I had the same battle that the one that was referred here. So I had the responsibility of leading this agency when this pandemic started in my country. And the pandemic put this topic at the center. But the pandemic was just showing the peak of an iceberg that was much complex and much bigger. But crises are sometimes opportunities. And the pandemic gave us a chance to put this topic at the center of public conversations. And I actually was resonating with what young people were expecting from us. Because what happened during the pandemic? It was not only that health services were under pressure, of course, and that was an urgent and basic need. But what happened is that schools were closed, parks were limited. So all of those community spaces where young people were meeting happened to be interrupted. And that's where we are aware how critical it is that we address this topic from that community-based approach. But again, crises are opportunities. And what started like as a very tough thing, because why is the Youth Affairs Agency taking a lead on this topic if this is a topic of the Ministry of Health? And then the Ministry of Education saying, but this is a responsibility of the Ministry of Health. And I'm sure that this resonates with all of us when we go back to our communities. And when I joined the UN, and after some consultations, and when you look into data, and every time there's a consultation now on youth, this is emerging as one of the key topics that young people are expecting something different from us. And if we connect that also with the data trends that shows suicide rates growing, anxiety and depression growing, the current pressure that even social media is creating at the policy level in so many countries, this gives us an opportunity to really give this topic the space these topics demands. Because when we're talking about mental health and well-being, we're not talking about one SDGs. We're talking about the foundation of all of the Sustainable Development Goals. So a few weeks ago, DESA, the Department of Economic and Social Affairs, launched a youth report. Every 2 years, they launch a very important youth report with evidence and data. And what the report showed, and this year that report was focusing on youth mental health and well-being, is that 75% of young people still have fear when speaking to someone about their experience on mental or emotional distress. And this is not just because sometimes in some contexts, services are unavailable, or because there are systems that are fragmented. It's because we have still a lot of stigma. And that's why it's so critical also that we elevate this topic at a high level. This particular meta-synthesis that was done under the leadership of UNFPA and UNICEF has also brought us very clear data about what needs to be done. Like, I think there's no doubts. There's no lack of data on these topics. And it's very clear about the importance of multi-sectoral approaches when we are and when we want to impact on this dimension. And understanding that community engagement, health policies, education engagement is very critical, and that at the core of this agenda, we need to embed also youth participation as a key driver, because there's also an intergenerational gap on this topic. How many of you have heard old people saying that this generation is not able to deal with the problems I deal when I was younger? And it's not true. The world is very different now, guys. And this generation is much more brave to express what is needed to be changed. So it's not that this generation is more fragile than older generations. This generation has the capacity of putting topics on the table and demanding what needs to be done. So allow me to wrap up also with some also perspectives ahead. So there's many things happening from the UN side, and especially those things are happening at the country level. We have data, we have evidence, but what we still don't have is a political commitment to put this topic at the center of development. And in a context and in a world where what we are seeing is uncertainty everywhere. It's just about opening the news every morning, and uncertainty will be with us for that whole day. For those young people living in small islands, uncertainty is about surviving, because climate change, it's affecting their communities. For those living in conflicts, for those now in the Middle East or in Sudan or in Afghanistan, it's about really a threat to life. And it's about the wounds of conflicts in their lives. So in terms of my commitment as head of the Youth Office and as Assistant Secretary General for Youth Affairs, this topic remains at the center of our advocacy efforts. That's why since last April, we started an important work to bring together those that are already leading on this topic. And we started with UNICEF, with WHO, with UNESCO, with UNDP, with UNFPA, with those in the ground. We say, okay, how we come together to elevate this topic at the political level. Because we know that also this system works that way. We need the political commitment of the governments, of the member states, to change the approach. And our whole perspective and vision under this flagship initiative whose call to action is let's meet youth where they are. And this is a conversation of the youth. So if we want a UN that is relevant, a UN that is fit to purpose, a UN that is able to address the topics that this generation is demanding, we need to meet the generation where they are. And this is their conversation, this is their topic. And we also need to address this topic from an ecosystemic approach, because a responsibility to implement policies and to have commitments on budgets, it's not of a Ministry of Health in a government. It goes across the whole of the government. And it's about of also changing the paradigm. So let's move from treating symptoms to really addressing the base of these challenges. It's about care. It's about connection. It's about community. It's about dimensions of our lives, from employment to environments to sports and to peaceful societies as drivers of our well-being. And in a world where the majority of young people are actually in the most affected zones, because each of these countries I was talking about where conflict is now happening, those are youthful countries. And young people will be pushed to the front lines of these conflicts and will be the most affected by these conflicts. So in a world which is at that point, I think how we come together to elevate this topic is so critical. So I know this is just one more of many more things that will happen on this agenda. And to those that have been driving, that have been championing this for a long while, I first thank you. And what I can say is that you count on me, you count in our office as a convener, but I think the action, it's a collective one. So it's great we have ministers here. It's great we have youth-led initiatives here. It's great we have youth delegates that will bring them to their delegations, because the truth is that the responses to this agenda, so we move to support instead of being silent, and we move from stigma to really shared responsibility. Thank you very much.
Another big round of applause, please, ladies and gentlemen, for our ASG on youth affairs. Okay, so we've seen that today's discussion was very rich, very diverse, very powerful. We were supposed to play a video earlier. Let me just see if the technical team, Tammy, could you please help me with my computer? So this video is on youth and mental health, which was done by UNICEF. It's a 1-minute video. And we'll try and see, I know you are supposed to leave soon, ASG, but we wanted to ask if we could just all take a quick picture with the ASG. So I'll keep it very quickly. Okay. So thank you, UNICEF, for the consideration. So we'll just wrap up here. Thank you so much for everyone who's come, all the panelists. Thank you for all the youth delegates, all the ministers, the high-level senior advisors and government officials. Thank you so much for participating in this discussion. And what we've seen is that the evidence now that we have, we need to do better. And I'm so grateful for what our ASG mentioned, to say that we should all commit to the cause that youth and mental health and health in general needs to be addressed holistically. So I would like to mention that the full report that was presented, the preliminary findings presented by Tammy, the full report will be released in a couple of weeks. So a big thank you for your active participation. And last but not the least, those who are online, our apologies, but those who are here, please feel free to grab some coffee or tea or some fruits over there provided. I was your moderator. My name is Nsansha Faith Chilupula. I am from UNFPA Independent Evaluation Office. A big thank you to you all. Okay, so before our ASG leaves, I kindly ask that all of us come to the front and our ASG will be in front and we take a group photo. Quickly, please, quickly. Oh, you can sit. Maybe you can sit. Our minister can sit. So maybe the minister can sit there. Okay. Our minister can sit there.
Could we see the video of the young person that we couldn't see?
After we take a picture. Okay. Could we please come to the front for the group photo? Quick group photo, please. Could we settle for the group photo? We'll remain to say hello. Our ASG can take the seat. Our minister can also take the seat. Let me just quickly coordinate this. Okay. There are chairs right behind you. There are chairs. Okay. Oh, so we will need people behind the people. We need people behind here. There's a space here. Okay, I think. Just a moment. Let me just have people. We don't want anyone hiding. Valeria hiding. Could you? Yeah, come. Okay, there's a young person hiding there. Vanessa, come here. And our lovely young person over there as well, come here. Here. There's a space for you here, ma'am. Okay. Come inside. Here. In. I don't want anyone left behind. No one left behind. Okay, we're ready? Okay, we push in. Come inside. Here. It's okay. Yeah. Okay. Okay, so at the count of 3, we say SDG. 1, 2, 3. SDG. Which camera are we looking at? One more time. 1, 2, 3. SDG. Oh, who's taking the picture? What? Lastly. 1, 2, 3. SDG. Awesome. The G makes you smile. Thank you very much, everyone.
How we can get the picture?